Asia.
Yes,
Dr.
doctor.
Asia, good evening. Sorry, thank you for organizing the free sections. I'm really glad about that. I just have a question for you. Like, is it better to verbalize your investigation before telling the patient your diagnosis?
Yes. Yes, of course, doctor. Regarding, first of all, you're very welcome. And secondly, you asked that we have to verbalize the investigations. Doctor, now there are two parts in, like in some stations, there are two occasions where you have to talk about the investigation. Sometimes you have initial investigations, and then you have investigations which need to be done by the specialist. Okay. Initial investigations you need to do because sometimes you can sound scripted if you have not verbalized your initial investigations. Okay, for example, there's a station where you have to diagnose MI, okay, and you haven't verbalized, for example, ECG, you haven't verbalized the cardio markers initially, and then sometimes what happens, some examiners are very kind and they will still give you the investigations. Some are not so kind, okay, and they will not give you anything. And then you will be clueless and you will still be giving the management. So in that case, if you did not have the evidence to prove that this patient really had a heart attack or MI, and then you give the treatment without the evidence, what does that mean? You're a scripted doctor, okay? You knew the station beforehand. And that's why it's very important you tell the investigations to the patient. Doctors, now investigations, if at all, they are given in the, sometimes they are in your task statement as well. Okay, so you even need to verbalize those investigations to the patient as well. And investigations, you have to explain to the patient in simple language. That's what I do in my course. Every station when I'm covering, I am saying everything in simple, normal language, the way you will talk to your patient. That's what most of the academies fail to do. So, doctor, I hope I have answered your question. It was a long, yeah.
Okay, please, I just want another clarification. But are there times that we do tell the diagnosis, then after the diagnosis, we talk about the investigations? Because that's actually what we do in real life.
Okay, so doctor, I can hear my voice again. Okay. All right, doctor. So back home, what happens is that the practice is totally different. We don't talk to the patient. There are loads and loads of things. You have to change your mentality over there. And that's where you are going to be confused, because you don't talk to the patient in that much detail back home. But here, the system is totally different. You need to tell. Patients are very well informed. Sometimes they have more knowledge than you do. Okay, so that's why here it is very normal talking to the patient about absolutely everything. Okay.
Dr. Asia.
You're welcome, doctor. Okay, doctors, rest of the questions I will take after the session, because many doctors look forward just to the session and they have less time. So we should consider that. Okay, let's go ahead and start our session. Okay, Dr. Abdullah, you have a long query. Don't worry, I'll look into it in a minute after the session. I can't read such a long message. And you know that, Dr. Abdullah, I'm always there for you all. And you can always ask me, right, in the group, in case I don't get to read that. But I'll try my best to read that at the end, okay? All right. Okay, doctors, let's go ahead. Okay, I don't know if this is a... Let me mute everybody, I think. Mute all. Okay, participants and mute all. Okay, doctors. So this is a very, very new station, doctors. I don't know if at all it has been covered by any academy or online courses as yet, but I am covering it. So yeah, all right. Okay, doctors. So, doctors, as in the previous session as well, as I said that I want you to get benefited by these sessions as much as possible. I could just simply do the prenatal cystic fibrosis station, but then I thought if there is any station that we can group together along with this station, why not? Okay. I just want to give you an idea as well that how if you are self-studying, okay, or if you have been to any academy and you do not have any idea how to group the stations together, okay, and how to make your life easier, this is the way, doctors. Okay, so there was another station where you can take the similar kind of a history, okay, more or less, all right, which is your prenatal counseling, okay, where previously there was a station where a lady would come and she's just here, she wants to get pregnant, and she's just here for the prenatal advice. Now prenatal advice, if any one of you is not clear, because I always teach at everybody's level. Okay, doctors, there has been some problem with the wow, why the eraser is not working. Let me see, doctors, let me share it again. Okay. All right, doctors. So, okay. So, doctors, there, as I said, that apart from now, the new station that has just appeared in the exam is about where a lady wants to get pregnant, but her brother has cystic fibrosis. Okay, her brother has cystic fibrosis, and she wants to know what is the risk, okay, for her baby to develop the cystic fibrosis as well. Okay, and she will have a couple of questions that you have to answer. She might have a couple of queries that you have to answer. Okay, now there was another station where a lady appeared before getting pregnant. Okay, but in that station she does not have a particular concern, she just wants a general advice. She wants to get pregnant and she wants a general advice. All right, now there can be, doctors, there can be variation in the stations. For example, sometimes the same station, they can change into, for example, a lady having high blood pressure and she wants to get pregnant. Okay, or a lady having thyroid problem and she wants to get pregnant. All right, a lady wants to get pregnant and has a concern. Okay, so this is both of these stations. What is common? The common thing is that it is a prenatal counseling before getting pregnant. Okay, in both the stations, lady is not pregnant, she wishes to get pregnant, but she's here for some advice. All right, okay. So doctors, because this is some advice they want to get before getting pregnant, okay, now let's take the case of cystic fibrosis first. Okay, cystic fibrosis first, where the lady is saying that, doctor, I want to get pregnant, but my brother has cystic fibrosis. Okay, now what is the risk for my baby to develop this condition? Okay, now doctors, again, I told you previously as well, whenever there is they bring up anything about their relative, okay, that is a very, always think, this is a rule of thumb for your Plab 2 exam, this is a golden chance for you to cash your interpersonal skill score. Okay, you can gain, they talk about any relative, just grab that chance and avail it for you to increase your interpersonal skill score. For example, here, okay, now usually doctors who are scripted doctors, they will not talk about, they would not want to know about the brother at all. Okay, now there are two reasons, doctors, why you want to ask about the brother. First thing I have already told you, because you want your interpersonal skills to be high, okay? Your interpersonal skills score to be high. Second reason, you want to know because, first of all, brother, sometimes they might just be talking about their cousin brother, okay? Brother, what brother? Okay, how's he related to you? Is he your real brother? Okay, and at what age did he have this? How is he coping? All these things. How is your brother now? What is his age? At what age was he diagnosed? Okay, and how is he coping with his condition? Now, all these questions will gain you interpersonal skill score. Okay, doctors, please hold your horses. Who is doing this, doctors? Please, if you are an agent from another online course, please don't do this. Okay. Otherwise, it may result in me kicking you out of the session. All right, please hold your horses and don't scribble on the screen. All right, okay. So doctors, also you have to ask, if at all, is it just your brother, or if at all there's anyone else who's been diagnosed with the same condition? Okay, because now asking these questions, doctors, you are not asking these questions without a logic. You want to find out what has been the family history like, what has been the fashion like, how badly this condition has been affecting this family. Okay, so you are actually trying to figure out something, and at the same time, when you're asking, when you're caring about her, when you're caring about her brother, you are just showing your empathy. Okay, your empathy. Now, empathy, doctors, many of the academies I know, they say these two words, sympathy and empathy. I apply it and I tell you that by body language and by your words, by your, by asking different things, you can show your empathy instead of just, keep on saying, I am sorry, I am sorry. That does not show any empathy, doctors. Okay. Sympathy and empathy, they say, yes, interpersonal skill score. How do you increase them? Sympathy and empathy. But how do you show it? What is the way of showing sympathy and empathy? This is the way, doctors. Caring for the patient. Caring, because you know what? If any of keep yourself always in patient's shoes and imagine, if any of your family member, God forbid, touch wood, was affected, will it not be affecting you like that? And if somebody asked you about your relative or about your brother, wouldn't that make you feel better? You would feel good. Okay, you would feel good. That's it. That is what is your aim. You want to show to the patient that you are caring for their matters. Okay, and they matter to you. It's not just like a robotic conversation. It's a real human interaction. And that's what GMC wants from you. Real human interactions, not just robotic talks. Okay. All right, doctors. Now, I told you, doctors, that I will always give you a reason to take a history in a particular station so that you know what are the things that I can just skip from my general approach. Okay. By the way, doctors, for female health or for obs and gynecology stations, also we have a generalized pattern. But what can you exclude from that pattern? By you have to know that what is important for this particular station, and the rest of the things I can forget about them and I can just take focused history. Okay, doctors, again and again, now these words are very important, doctors. Focused history. They don't ask questions in your Plab exam just for the sake of it. Okay, not just for the sake of it. Your questions have to have a logic behind them. You have to be asking them for a reason. Don't just ask just for the sake of asking. Otherwise, that will take your time. You will be wasting your time, and also you will not be gaining anything. Instead, you will be losing time and not coming on to your management. Okay. All right, doctors. Now, this part is very, very important. Okay. Now, doctors, I haven't spoken about the initial part of the station where the patient will come. They will introduce themselves to you, okay? And they will say, doctor, I have, okay. Hello, I'm Marcia, one of the doctor here. Can you please confirm your name and age for me? Okay, doctor, this is my name and age. Well, nice to meet you, Andrea. Andrea, how may I help you today? Well, doctor, I'm a bit worried because I'm planning to get pregnant and my brother has cystic fibrosis. All right, first of all, it's really good to hear that you want to start your family now. Another point where I am catching the interpersonal skills score, okay? Second point, okay? So I said, well, Andrea, it's really good to hear that you want to start or you want to begin your family. Now, regarding your brother, I'm so sorry to hear about him. Can you please tell me more about your brother? So this is open question, doctors, I'm asking initially. Always start your station by asking open questions, okay? That will give you so much more information, okay? Yes, doctor, he has got cystic fibrosis in blah, blah, blah years. Now, it has saved you some time from asking some of these questions maybe, okay? Some of these questions maybe, you don't have to ask maybe anymore because you said, can you please tell me? Oh, has there been no room for more participants? Oh, doctors, I'm so sorry because we've got 100 and I can't take more than 100. I'm extremely sorry for the doctors who are not able to join. Okay, all right, better luck next time. I'm so sorry. Well, I'll try my best to do something for them. I don't know. Okay. Anyways, let's carry on with our session because I can't do anything about it. I can't increase the capacity. That's the most you can take on Zoom. Not more than 100. Okay. Anyways, doctors. So doctors, so some of these questions she might, when you said, please tell me more about your brother, she might have answered some of these questions already. Doctor, well, he had cystic fibrosis since he was 10 years old or 5 years old. Doctors, by the way, cystic fibrosis starts, the clinical features start appearing very early, okay? Especially in males, male babies, they start appearing very early. So she might be saying he was 5 years old, blah, blah, blah. Okay. So I reckon it has been very long time that he's been suffering. How's the family coping? How is he coping? How's his treatment working? Okay. Now, apart from your brother, well, doctor, he's doing well. He's coping well. Very good to hear that. I'm glad to hear about your brother, that he's coping well. He's not doing well, doctor. Well, I'm so sorry to hear about that. Okay. All right. And then anyone else, doctors, this is important for you because this is important for you to know. All right. That anyone else apart from the brother has been having cystic fibrosis as well. Okay. What about other members? Doctors, you can ask this question here, or you can even ask in family history later, if at all you forgot here. Doctors, now regarding the focused history, what other history you have to take from this cystic fibrosis patient? There are a couple of things that are important. Now, doctors, the usual history structure for OBS and gynecology stations, okay, that we have a 4P structure. Okay, we have a 4P structure, but here I have made it 5 Ps for you. Why? Because partner, another P, which is partner, taking the history about the partner is very, very important as well. Why? Because you want to know if at all anyone from her partner's family has got cystic fibrosis or not. Okay. Why, doctors? Why? Because you want to know, are these two guys, okay, who are planning to start their family, how strong family history of cystic fibrosis is, okay? What are the chances of being both of them carriers, all right? And how quickly you have to act according to that. That's why knowing about, okay, you have asked about her family, that who else has got cystic fibrosis, it is also very important to know that about the partner, okay? Whether or not partner has got cystic fibrosis, whether or not anyone from partner's family has got cystic fibrosis, okay? Very important questions, doctors. All right, doctors. Now, you can even signpost before asking these questions. You can say, well, doctors, now you are going to ask about her general health, all right? And she's worried about having a baby with cystic fibrosis. So you have to sound logical to the patient that why you are going to ask further questions. Well, Andrea, your concern is very valid because your brother has got this condition. Now it makes sense, or you have taken very good step to come to us today. Or you can just simply say, very well done, Andrea. Now it makes sense to think about this condition before you got pregnant. You have done very well by coming to us today. Now, what I would like to do, I would like to ask you a few more questions so that we can find out what are the risks for you and for your baby for developing this condition, okay? Now, you have given her the logic of asking further questions, okay? And you are going to, now you have given her why you're going to ask further questions, all right? Then start asking about her period, okay? How are your periods? Now, doctors, you will ask me, Dr. Asya, are her periods related to cystic fibrosis at all? Doctors, there are a couple of things that are included in the female history or female health history, okay? They are just part of it. And there is actually a logic, because if at all she's trying for a baby and her periods are not regular, as a safe doctor, as a caring doctor, which GMC requires, do you not want to know that this lady is trying for the baby, and to start with, even her periods are not regular? Do you not want to know about her periods? Okay. Also, do you not want to know about her pregnancies? Okay. What were the outcomes if at all her other children had this problem at all? Or what was she told when she had previous pregnancies? Okay, in this case, it could be her first baby actually. But as a safe doctor, you must ask, okay? You must ask about the previous pregnancies as well. Now, pills, if at all she's taking contraception and trying for the baby. Or if at all she was taking contraception previously and she has started trying for the baby, she might have another stress on top. What is that? Because when you are taking contraception, for example, pills, or you were having any IUCD, it might take some time for you to get pregnant. You might even have to talk about that in the management. So to start with, do you not want to know that what method was she using for contraception previously? Or if at all she was using any method of contraception? So you see, these things are logical, okay? And partner, doctors, we have already talked about why it is important to know about her partner, because partner is important because partner's family history of cystic fibrosis, if he has got a family history of cystic fibrosis, there is a risk, okay, that he could be a carrier as well, okay? So that will change our management, right? We have to be even more quicker in finding out for this lady. She shouldn't be trying for a baby at all without testing, okay? Without doing further or without doing the genetic testing, okay? So that's why partner history is important as well. All right, doctors? So doctors, what questions will you ask? Let's start again. Let's begin from the start again, okay? So we have talked about the beginning of the station, and we have talked about the interpersonal skills, how we will catch by asking about the brother, okay? Asking about the brother and the family history of cystic fibrosis is important, okay? Now we will tell her that your concern is very valid. We'll look into that, or we will find out what are the chances of your baby to have this condition. But I would like to ask you a few more questions about your general health, Okay, first. So you'll be asking the question, all right? So you will be thinking in your mind, now I have to ask about 5 P's. Okay, 5 P's. First P is periods. Okay, may I know how are your periods? Or you can even say, are your periods regular? Okay, you can just ask a focused question. How are your periods? Doctors, don't worry. I will repeat again. Okay, I will give you a summary at the end of this session. Okay, so don't worry if at all you have missed. Yes, definitely, doctor. I will tell you. I will tell you the signposting as well again. Well, doctor, okay, fine. I'll repeat the signposting line. Well, Andrea, your concern is very, very valid, and you've taken a very good step to come to us today. It makes sense because your brother has got cystic fibrosis. You have got a you have got a family history, and this condition, unfortunately, does run in the family. So I would, just to find out what are the risks for you and for your baby, I would like to ask you some more questions. Is that all right? Yes, doctor, that's fine. Okay. All right, doctor, if you have not got me, don't worry, I'll repeat myself again. Okay. All right, doctors. So periods, doctors, first P, your first P is periods. And what are the questions you should be asking about the periods? Okay. How are your periods? Okay. Any problem? Or you can just ask a focused question, any problems regarding your periods? Okay. And also, you can ask different questions. If you think that you have enough time, you can ask, are your periods regular? Do you have any heavy bleeding at all? Do you pass any clots by any chance? Any spotting in between? Okay, any spotting in between? All right, doctors, these are the periods questions that you should ask. If you have less time, you will get the same credit. Just ask that about like any problem regarding your periods. Okay, do you have any problem with your periods at all? Okay, just give me a second, doctors. All right. Okay, now your second question, second part, second P is pregnancies. Okay, may I know, okay, is it your first pregnancy or you had any other pregnancies in the past? No, doctor, this is my first pregnancy. Good. Okay, if at all she has been pregnant in the past, please take the history of those pregnancies as well. Okay, did you visit your doctor during those pregnancies? What was the outcome of the pregnancies? And if at all she had children, any complications in your pregnancies? Okay, and then if she had children, any health issues with the children at all? Okay, because you want to know if any children were carriers or any children had cystic fibrosis or not in the past. Okay, because it could be a mother who has a cystic fibrosis child already. As a safe doctor, you should be ruling out. She could be worried now for the second one. Okay, you don't know. A scripted doctor wouldn't think about all of these things, right? They will just ask question for the sake of asking without knowing the reason. Why am I asking a particular question? Okay, doctors. All right. Now your third P, doctors. Okay. Third P. So I reckon that you are trying for a baby now. Have you used any mode of contraception previously? Or are you using any contraception at all? You can just ask. Have you used any contraception at all? Well, if at all, they have given you a history. Yes, doctor, I was taking pills. Okay. Since when? And have you stopped taking them now? Okay. Or when did you stop taking them? Okay. And if at all, she had IUCD. Doctors, I told you the reason why you need to talk about it, why it can be relevant, because in management, she's trying for a baby. She shouldn't be frustrated. She visited a doctor. Doctor should tell her that actually it can take some time for you to regulate your periods and then falling pregnant. It can take some time. Okay. All right, doctors, why contraception is important. Okay, let's go ahead. Now, doctors, going further down in your history, your next P, your fourth P is about partner. Okay, ask, well, Andrea, may I ask, is your partner wishing for this pregnancy as well? Yes, doctor, he wants, is he happy? Does he want to have a baby as well? Yes, doctor. Oh, well, that's very nice. Again, I'm increasing my interpersonal skill score. Okay. Well, Andrea, what about your partner? Is he excited to have a baby as well? Yes, doctor. He does want a baby as well. Lovely to know that. Lovely to hear that. And then again, you have got some IPS, and then go ahead and come to the point. The point is you have to find out if at all he has cystic fibrosis. Okay. All right. Yes, doctor, you are right. So ask about, does he have any health issues? For example, cystic fibrosis. Anyone from his family has cystic fibrosis at all? Because anyone in the family having cystic fibrosis can make him a carrier, okay? Especially the first degree relatives. All right. Okay. Now your next P, doctors, your fifth P, your last P is Pap Smear. Okay. Now some of the doctors again, please be patient, because I am teaching everybody. Some of you have just started preparing for Plab 2 exam. Okay. So Pap Smear, doctors, if some of you are unsure, here in the UK, Pap Smear is done for all the women who are above 25 years old. It is a screening test, okay, which is done for cervical cancer, and all the women above 25 are supposed to do this, okay? And this test is done every 3 years, okay? This test is done every 3 years. So ask the woman, okay, ask the lady that, may I know, when was your Pap Smear done? Okay, when was, doctors, can you please stop scribbling? This is very kiddish, by the way, doctors, very kiddish. Okay, so ask that, when was, may I know, when was the last Pap Smear done? What were the results like? Okay, what were the results like? Because you want to know whether the results were positive or negative. Doctor, do you want a lady whose results were positive? Do you want her to fall pregnant without you knowing? Because what if she has an underlying medical condition? Okay, so Pap Smear, please do ask about Pap Smear. What if she has missed her last Pap Smear and she has come to see a doctor, and if the doctor does not recognize that, you are not a safe doctor. Okay, so there's a logic behind doing everything. All right, doctors. So your 5 P's. Your 5 P's you will ask, okay? This is your history, and you are going to take a focused history. All right, let's go ahead. Okay, doctors. Now, after asking about your, well, I don't know, doctors, what is happening today. Because some of you are trying to scribble here, and then I can't use the eraser for that. Okay. Now what I have to do, I have to stop sharing the file again, share it again. Please don't do that. If you are from agent from another online course, please don't interrupt me. Okay. I only can request you. All right, doctors. Now again, doctors, it's happening. Please stop it. Okay. Please stop it. All right, doctors. Okay. So doctors, after asking about the 5 P's, now you will ask, usually doctors, in your normal history, P1 is your main complaint. Usually doctor, any patient comes and says to you, doctor, I have tummy pain, doctor, I have headache, doctor, I have chest pain. That is your P1 of your history. Main complaint or main concern is always called P1. Now here in this station, what is it, doctors? She's having a concern, which is P1. Now, after P1, usually will come P2, okay? P2. Now, P2, what is P2? P2 is always past medical history, okay? If at all she has any past medical conditions. So ask her, Eliza, do you have any medical conditions at all? Okay, do you have any medical conditions at all? All right, any womb problems, any problems with your periods? Okay, always, doctor, past medical conditions, ask the relevant ones. Okay, you can sometimes doctors say, doctor, can I just generalize, and can I say past medical, just the past medical conditions? Well, I'm doing the course, when I'm conducting the course, doctors, for every station, I also tell you what are the relevant past medical conditions, because sometimes it's necessary to ask the relevant past medical conditions. Okay, so that's why it's important. All right. Okay. All right, doctors. So your you will ask, do you have any past medical conditions, any womb problems, any other problems with your periods at all in the past? Okay, and then any surgical procedure. Surgical history is also important, in especially in your obs and gynecology stations. Okay, any female health stations, past surgical history is also important. Okay, this lady going to have a baby, we need to know, we need to have this information in her file, in her medical history, whether or not she has had any surgical procedures in the past. Okay, any cesarean sections, any other procedures at all. Okay, so that you have to ask, and plus you have to ask MEFO. Okay, what is MEFO? Usually we ask MEFTOSA, but you don't require all the elements of MEFTOSA here. All you need is medications, allergies. M is for medications. Are you on any medications by any chance? Okay, any allergies at all? Okay, which is A. F is for family history. Now you know the cystic fibrosis. Okay, you know the cystic fibrosis. Doctor, I'll tell you why not social. Okay, you know that she has cystic fibrosis. Now you can just ask her, apart from cystic fibrosis, is there any other medical condition that runs in your family? Okay, or that runs in your first degree relatives, okay, or in your blood relatives, you can say, in your blood relatives. All right, so that's your covered F. Now, doctor's occupation. Okay, what do you do for work? What do you do for living? Doctor, I'm a housewife. Well, you must be a busy lady then. Okay, doctor, I am a housewife. You must be a very busy lady then. Okay, I must say unpaid work. I must say unpaid work. By saying all these things, you are just developing that comfortable space in the consultation room, and you are increasing your interpersonal skills scores. Okay, and if at all she says, doctor, I work as a receptionist, I work in a property business, how's everything at work? Okay, sometimes doctors, again, when I'm conducting mocks, doctors ask the occupation question just for the sake of it. Doctors, occupation question is for a reason there. Okay, it is there for a reason. Now, sometimes the reason is the job creating any stress, which is the case here as well. Okay, any lady trying to get pregnant, you have to find out if at all she is stressed, because stress can reduce her chances of falling pregnant. Okay, so that's why. Now, in some stations, you ask about the occupation because it could be a lady who had a wrist fracture. It could be a lady who had a fall. It could be a lady who cannot see properly. It could be a man who cannot maintain his balance. Now, all these conditions, do you think they will be able to carry on with their work? They can't, and you have to deal with it. When I do those stations, I do tell my doctors how to deal with those problems. My aim is here just to tell you that any question we ask in the history shouldn't be aimless. We are asking questions for a reason. Okay. Now, psychosocial history. Doctor is asking, doctor, why you are not putting here? One of the doctor has commented in the chat box, why not social history? Now, what is the social history, doctors? What question do you usually we ask? How is everything at home? Okay. Now you can cover that while asking about the partner. Okay. You could cover that while asking about the partner. Usually you ask about the family in the social history. You ask how are the things at home, who do you live with. You have asked that enough already, okay? Whether she has children or not, whether she lives with a partner or not, okay? All those things are already very important. Yes, doctors. So you need to ask about her. You need to add DESA as well, okay, before your MEFO, okay? So add DESA. DESA is very important, doctors, in where a lady wants to get pregnant, okay? Sorry, I kind of forgot that. Okay, let's add that. Doctors, all these things can be a very big risk factor for her not to conceive a healthy pregnancy. What is DESA? D is for diet and drugs. E is for exercise, which is physical activity. S is for smoking, okay? And A is for alcohol. Now, any lady doing any of these things, okay, smoking or alcohol, not good for the baby. Any lady taking recreational drugs, again, not a healthy pregnancy. Any lady not taking appropriate diet or not being physically active, it will not lead to a healthy pregnancy. Now, the other station that I was talking about, okay, there the DESA will be very, very, very important for you, because you have to talk about DESA in detail in the management of that station, where a lady is just coming for preconception counseling, okay? She is not coming with the concern. She's coming just for prenatal or preconception counseling, okay? Doctor, I want to get pregnant. I just want to get a general advice, okay? What shall I be doing? Or what kind of things I should not be doing, okay? So doctors, whether or not any of these both stations, you will ask about diet, you'll ask about recreational drugs if they are at all taking, you'll ask about physical activity, okay? How will you ask these questions? Now, doctors, before drugs, there are a couple of things you will always signpost before them in your Plab 2 exam. For example, drugs, okay? For example, sexual history, for example, family history of cancer, okay? You will always signpost before these things. And there is a way to signpost. Maybe in another session, I can tell you about other things as well, how to signpost. But right now, just take home the drugs signposting, okay? Drugs signposting. Some of the doctors ask me sometimes, Dr. Asia, why not smoking and alcohol? Why don't we signpost before them? Well, doctor, smoking and alcohol is quite common in this country. It's more or less part of the culture. So if you ask just straightforward question, do you smoke? Do you drink alcohol? No one is going to get offended, okay? We just don't want to cause any extra anxiety or any worry or we don't want to be offensive to the patient. That's the purpose of signposting. Sometimes because, again, doctors come from academies, doctors come from, different courses, and they do things, they are told to do things, but they don't know, why am I doing? Doctors, if you know the logic, if you know the reason of doing a thing, it's much easier for you to follow it and to remember it, okay? So why do you signpost? Again, you want to signpost before drugs because you don't want to be offensive to the patient. For example, I'm not a drug addict. I'm not even an alcoholic. In my culture, nobody drinks alcohol. Even if somebody offers me alcohol, I can be offended, okay? Well, because I'm a bit open-minded, so I might not be, but I'm just talking about the culture. I'm just trying to explain to you the difference in the culture, okay? But here, asking about alcohol and smoking, you are not offending anyone, okay? But drugs, yes, you will be offending because not everyone is a drug addict, okay? So how will you signpost before the drugs, okay? So, all right. So doctors, you can say to the patient regarding the drugs that the question that I'm going to ask might sound a bit offensive, but this question is asked as part of consultation, okay? Or we ask this question so that we are not missing anything serious. And you will not wait, you will just ask the question straight ahead, okay? You will just ask the question straight ahead, okay? Well, do you take any recreational drugs by any chance? Okay. All right, doctors. So there we are. We have covered the history, doctors. Now, after taking the history, you will have to do the vitals, okay? You have to check the vitals. You have to verbalize it. You will not be doing it, but you will be verbalizing it, okay? Just after the consultation, I would also like to examine you just to make sure everything is all right, okay? Just to make sure everything is all right, okay? So I would like to examine, I would like to check your observations, which is your blood pressure, temperature, and your heart rate. Also, I would like to examine you from head to toe, okay? She wants to get pregnant, so we have to check a general health check, okay? Her observations, which are her vitals, and a head to toe examination, okay? Which is general physical examination. Now, doctors, why do I like to explain these things? Because this is how you have to talk to the patient, okay? Okay, doctors. Doctors, by the end of the session, to the negative people, I would want to say something, okay? Who are spreading negativity in the chat box or anywhere. I would like to say something to them in the end, okay? Anyways, let's carry on with our management. The main part that we need to know, especially doctors who are appearing in the exam in coming days, because some stations tend to repeat. So you never know. In coming days, cystic fibrosis station may repeat again. Okay. All right, doctors. So doctors, now every station after you
बस
have
मैं यही पूछ रही थी कि अब फ्रेंच की इंडक्शन है, वो उसमें भी इंट्रोडक्शन वगैरह कराएंगे?
नहीं, वो दूसरे स्कूल में।
वो तुम कह रहे सामने ही है ना?
Okay, doctor. Okay, doctors, please mute yourself. Okay. All right. I've muted everybody now. Okay, doctors. So, doctors, how will we manage this patient? Now, doctors, at this point, you have to always, at this point, what do? You usually tell the patient, okay? You tell the patient what, you ask them first what this condition is. This is usually the time in usual stations, this is the time of giving a provisional diagnosis to the patient. But here, because these are counseling stations, so in counseling station, at this point, patient already knows about the condition, okay? Which is cystic fibrosis. Her concern is about what? About cystic fibrosis. Okay, so how much, may I know how much do you know about cystic fibrosis, and how does it, or how is it inherited? You're checking the knowledge of the patient, because according to that, you are not a scripted doctor. You will only give the patient some information according to what they know or they don't know, okay? So you will check the patient's knowledge first. And I told you, your purpose of checking the patient's knowledge is so that you don't waste any time. If they have some knowledge already, start from there onwards, okay? So, well, Eliza or Andrea, may I know how much do you know about cystic fibrosis? Doctor, yes, I know quite a lot because my brother has suffered. It has this. Well, you're very right. Okay. Well, you're very right, Eliza. Okay. If she doesn't know anything, okay, she says, yes, I have some idea, but doctor, usually this is how they will, behave in your Plab 2 exam doctors. They will appear clueless, okay? They will appear clueless. They want to hear the definition from you, okay? So here you will tell her what the cystic fibrosis is. Why you want to tell her what cystic fibrosis is? Because you have to explain to her in a minute how the genes are inherited. So for that, you need to have a context. You need to tell her that what a gene, a faulty gene is. That's why you need to explain to her what cystic fibrosis is, okay? So, well, Eliza or Andrea, this condition happens because of a faulty gene, okay? A faulty gene. Now, the genes are, are actually templates, okay? Genes are actually templates that have information of all the functions of human body, okay? Or about everything in human body. Genes are templates which have information, okay, saved for the human body, okay, saved for the human body. Now, in case of cystic fibrosis, it is a faulty gene, okay? It is a faulty gene that affects the flow of salt and water in and out of cells, okay? Doctors, you have to talk in this simple language, all right? It's a faulty gene. You have told her what a gene is. It's a template that has information about, so there are lots and lots of, there are hundreds and thousands of such templates in human body. Now, there is a faulty gene, okay? There is a faulty gene in cystic fibrosis that affects the flow of salt and water in and out of cells, okay? Now, this function, okay, affecting this function can affect vital organs in the body, particularly lungs and digestive system is affected, okay? Lungs and digestive system is affected, all right? So you can just simply tell her that it is because of the faulty gene. Now, this faulty gene, Eliza, this faulty gene can be inherited in the family, okay? It can be inherited in the family. But Eliza, I have a good news for you. This is not necessarily, okay? This gene does not necessarily inherited in all the siblings, okay? So this is inherited in a fashion what we call as autosomal recessive. And what you will do at this point, ideally, doctors, if you have time, if you have a pen and paper in the cubicle, explain to her this. Explain to her this. If you want to score 12 out of 12, you attempt to draw it. Whether you want to draw a heart and a circle, and you want to draw the faulty gene part, okay? And you want to connect them, and you want to explain it, okay? Explain to her, all right? Because you have to aim to explain to her the inheritance pattern, okay? Which is autosomal recessive. So, Eliza, if at all, we have to, first of all, our aim is we have to find out if at all you are a carrier, okay? Doctors, in some stations where they're expecting you to explain something to the patient, such a thing, you do have pen and paper. So keep your eyes and ears open, look at the table, look on your sides, if at all there is pen and paper, okay? Otherwise, you can just tell her that it can, the mode of transmission of this gene is autosomal recessive, okay? And the chances are, okay, you will explain to her the chances, okay? The chances are, if at all you are a carrier, okay, if at all, for example, assuming that you are a carrier, and if we have to find out about you and your husband, we have to check if both of you are carriers. Touch wood, if we find out you both are carriers, the chances in your baby. Doctors, basically what she wants to know, she wants to know what are the chances in her baby. So tell her what are the chances of her baby being a carrier or having a cystic fibrosis, okay? So you can tell her the chances of being your child a carrier are 2 in 4, okay? 2 in 4. The chances of your child having a cystic fibrosis, unfortunately, would be 1 in 4, or you can even say 25%, okay? Or you can say 50% chance of being a carrier, all right? Or 2 in 4 of being a carrier, and 25% chance that your baby will be completely normal, okay? Your baby will be completely normal, or your baby could be could have cystic fibrosis. So that's what is the aim of the station. Doctors, make sure, even if you are not able to do rest of it, please, up until here, she wants to know what are the chances. Up until here, management, you must aim to cover. Okay, doctors? What are the chances of my baby having a cystic fibrosis? Okay, so if at all there's pen and paper, you'll draw this, or otherwise you will. Yes, doctors, I will answer your queries. I'm not looking at the chat box at the moment. Okay. All right, doctors. So that you will do. Okay. Now, what other things you have to tell her? Okay. You will tell her about carrier testing. Now, Eliza, the step forward from here would be to find out about whether or not you are a carrier and your husband is a carrier. So for that, I would like to refer you to a genetic, okay, local genetic center. Okay, doctors, I am not saying it from my side. I have read it. I have properly researched it. For 2 days, I have been researching on this station, okay, in order to give you the appropriate knowledge. Okay, I even had a consultant. I had a friend visiting me this morning. She has 16 years experience in A&E. She visited me this morning. We had quite a good half an hour discussion on this. It was a good learning point for me as well. Okay, so so doctors, you will refer her. Okay, at this point you will refer her. You will say, I have to make a referral for you. Okay, I'll make an urgent referral to local genetic center where you and your husband will be tested. Now, doctors, how will we be tested? What will be the mode of test? Well, it can be a simple mouthwash, or they can even do some blood tests for you. However, the center, okay, when I refer you to the center, they'll explain to you how the test will be conducted and the other things, okay? And the other things they will be telling you, all right? They'll be explaining to you. Doctors, you will not have time to talk about all the sweat, blood, poo, wee, okay? So just say to her, simply say to her that they will explain to you, okay, in the center, all right? Okay, doctors. Now she might ask, doctor, what will happen if I am a carrier? Okay, she will say, doctor, what will happen if I am a carrier? All right, so you will tell her this. Okay, you will tell her this and this. Okay, you'll tell her all of this. You'll tell her, if at all we find out that, unfortunately, if we find out that both of you are carriers, then still the risk of your baby being born is 25%, okay? And in that case, the step forward would be that we will refer you for genetic counseling so that they can talk in detail, okay? The genetic counselor will be able to talk to you in great details. They will tell you that what are the chances of, and what are your options. For example, there's something called PGD, okay? Pre-implantation genetic diagnosis. So they can even talk to you about this option where you can find out even before the implantation. You can opt for test tube babies if you want, and they can find out before implanting the embryo in your womb, they can find out if your baby has got cystic fibrosis. Okay, and there are other options as well. What are the risks of carrying on with, and they will also tell you a great detail about what tests will be performed throughout your pregnancy, if at all you are a carrier. Doctors, if you want to talk about all the amniocentesis and whatnot, all of those, doctors, chorionic villus sampling, blah, 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 you will not have time for that, okay? So generalize things. Okay, just telling her, you don't, as a junior doctor, you don't need to give her so much information in detail. Okay, and ultimately she will be told. Okay, she will be told. She will be talked about all those things in genetic counseling as anyway. All right. Okay, so doctors, if at all, you will also tell her, if at all we find out that only one of you is carrier, then the risk will be very low, okay? The risk for your baby to have cystic fibrosis will be very low, okay? And however, as a part of screening, all the kids when they are born in the UK, they are always tested for cystic fibrosis. It's called a heel prick test, okay? All the babies, so even your baby, because it's part of screening program, so we usually test all the babies. Your baby will also be tested. Also, additionally, your baby will be tested for being a carrier later in their life, okay? They can be tested for being a carrier later in their life, okay? So if both are not carriers, you just reassure her very strongly that there are very less chances of your baby being a carrier or even having cystic fibrosis. So reassurance, she doesn't know, you will tell her, but in this scenario, because the blood test has not been, or the carrier testing has not been done yet, she doesn't know her husband is a carrier or not. She doesn't know she's a carrier or not. So in that case, you just have to tell her all the possibilities, okay? That if you are a carrier, what will happen? If both the partners are carrier, what will happen? And if both of you are not carriers, what will happen? Okay? Okay, doctors. Okay. All right, doctors. So doctors, at the end of the station, if at all you finish in time, okay, then she might have some concerns or questions. For example, she might ask you, doctor, this carrier testing and other tests, okay, will they be free of cost? Yes, it's absolutely. If at all you have a family history of cystic fibrosis, for example, your first degree relatives, or you can even say to the patient, instead of saying first degree relatives, say blood relatives, okay, or close relatives. If your close relative, in your case, it will be absolutely free because your brother, he's your first degree relative, or you can even say he's your blood relative. You will be offered these tests free of cost, okay? All right, doctors. So even if a patient does not have a family history of cystic fibrosis, even the partner, even if one of the partner has got cystic fibrosis, both of them free of cost can have carrier testing, okay? Both of them can have carrier testing. All right. Doctors, she can even ask you one more question. She can ask, doctor, can I do home test? Instead of going for the genetic center, can I have it done at home? I heard there are some kits available and I can do it at home. Well, Eliza, in your case, I would not suggest those tests because they can be unreliable. Okay, they can be unreliable, and you've got a very strong family history. So I would suggest, to be on a very safe side, you should go for this genetic center. Okay, you should go through proper professional body to get this test done. Okay. Doctor, what if my baby is just a carrier? Another concern or question she might ask, doctor, what if I find out that if my baby becomes carrier, will they be healthy? Yes, they will be absolutely healthy. There's only a risk that their children, if at all their partner has got, their partner is a carrier as well, then again, there'll be a risk in their in their offsprings, but they will be absolutely healthy. Okay, just reassure the patient, doctors. Okay. All right, doctors. So pretty much done there. All right, let's talk about the management of other station, where the whole history will be again the same. Again, you will be emphasizing less on the family history of cystic fibrosis, because in that case, patient does not have any history positive. In that woman who's coming for just the preconception counseling, and she does not have any particular concern, she just wants to get pregnant and wants an advice, in that lady, the history that you will take will be just 5 P's. You really want to know about her lifestyle, which is DESA, and you want to know about her MAFTOSA. Okay. Now, traveling again is not very important. However, psychosocial history, again, you will ask, okay, how are things at home? If at all any lady is wanting to get pregnant, you must ask in detail about her partner, because you have to know that if at all her partner is stable, okay, she has a stable partner, and her partner also is equally willing for this pregnancy. Okay, you have to ask such questions regarding the partner. Okay, is your partner, don't say is your partner willing for this pregnancy as well, no. Okay, just ask generally that is your partner excited for you to get pregnant, or is your partner excited for the further planning of the family as well? Yes, doctor, he's excited as well. Well, I'm glad to hear that. I'm glad to hear. I'm happy for both of you. Okay. All right, doctors. So that will be there. Okay. I have told you the five P's history again in other preconception counseling station as well. How will you manage that station where just the lady is here for the normal preconception counseling? Again, doctors, she will be 36-year-old. Deliberately, because many of the doctors mishear the age, they deliberately put a lady who is a little bit older. Okay. Now we know increased maternal age can pose lots of health risks for the mother and the baby. You have to talk about that. Okay, you have to say that we will closely be monitoring your baby and you, because sometimes there can be some health problems, okay, for you and your baby in this case. However, don't worry, we'll be closely monitoring you. But as long as you mention that her age can be a risk factor for a couple of things, don't even mention it's placenta previa, even the lots of things that can happen because of increased maternal age. Okay, but as long as you mention to her that you just want to show the examiner that my eye is on maternal age, because they deliberately put a 36-year-old or 37-year-old lady wants to get pregnant. Okay, and many of the doctors do absolutely everything and ignore the maternal age. Please don't do that. Okay, now again, talking about how often they are having sexual intercourse. If they are trying for a baby and not having sexual intercourse frequent enough, then her chances of falling pregnant are less. Okay, so just make sure you talk about that. You will just say that it is recommended or it is advised to have at least 3 times a week, something like that. Okay, sexual intercourse, it will increase your chances of falling pregnant. There are even over-the-counter ovulation kits that you can find out, and if you try during your ovulation days, it will increase your chances of falling pregnant. Okay, you can even talk about that, over-the-counter ovulation kits. Now talk about if at all there was a problem. Now scripted doctor will talk about everything. Your diet, you have to eat a healthy balanced diet, you have to be physically active, you have to do 30 minutes walk 5 days a week, blah blah blah. No, doctors, if at all, do patient-centered things. Okay, they want a patient-centered consultation. They want to talk about this patient. They do not want robots. They want real doctors who can pick up the problems and only counsel the patient according to that. So if at all there was a problem with her diet, her physical activity, you will only talk about that thing. Okay, that there was but however, you will advise her that include fresh fruits and vegetables. All the minerals and vitamins in your body has to be sufficient for your health and for your baby's health. Okay, talk about folic acid. Okay, we'll give you some supplements with advice of my senior. For example, folic acid, because again, it reduces the risk of some problems in the baby. Don't say neural tube defects to the mother. You know that it reduces the risk of neural tube defects, but how will you say to the mother? It will decrease the health issues or the health problems that can happen sometimes in the babies. Okay, also you can even tell her about inter-pregnancy interval. Okay, you can tell her, you can advise her about that for your health, it's important that you keep a gap. If at all you fall pregnant, you should keep a gap of about 18 to 59 months for your next baby to be planned. Okay, all right, doctors. So this is the management of the conception counseling and your cystic fibrosis station. Now, because the cystic fibrosis station was relevantly new, I will just give you a quick summary of that, okay? And then we are done for today's session. All right, doctors. So preconception counseling stations or prenatal conception counseling stations are 2 in your exam. One is just for general advice. One is where the lady is worried for her baby before she falls pregnant. She wants to know what is the risk for her baby to have a cystic fibrosis because her brother has got cystic fibrosis, okay? So what will you do? You will take a history, okay? You will take history, you'll ask about her brother in order to catch or in order to increase your interpersonal skill score. These are the questions that you will be asking about brother. Just generally asking, how is he coping? I reckon it is a long-term condition. Don't say chronic condition. Again, you will be using medical jargons. And medical jargons are an absolute contraindication for your Plab exam, okay? So you will be saying that how is your brother? How is he coping? What age? May I know? Well, I'm so sorry to hear about your brother, Eliza. Please, can you tell me more about him? Or can you please tell me more about his condition? Well, doctor, he got it when he was 5 years old, blah, blah, blah. If she answered all of these questions, no need to ask them separately. If she has answered all these questions just by asking an open question. However, if she hasn't answered all of those questions, just ask, how is he coping, blah, 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 and then catch the interpersonal skill score, okay? And anyone else, this is very, very important, asking that anyone else has got cystic fibrosis in the family. If at all you miss it at the beginning of the station, don't worry, you can ask it in the family history, okay? You can ask it in the family history. All right. Then you will ask about 5 P's, which are periods, pregnancy, pills, and partner, okay? Then partner and Pap smear. You will ask about 5 P's, okay? And then you will ask about the past medical history. You'll ask about DESA. DESA is missing here. Diet, exercise, smoking, alcohol, recreational drugs, okay? D for diet, D for drugs, okay? And you will ask about MEFO, medications, allergies, family history. If you have asked about the family history of cystic fibrosis early on, you can say, apart from cystic fibrosis, are there any other medical conditions that run in the family at all, okay? And then what do you do for work? I'm a housewife. Well, you're a very busy lady then, okay? Or I must say unpaid work you are going for. So you can say that, or if at all she's working, how are things at work, Eliza? May I know how are things at work? Is there any stress at all? Because she wants to fall pregnant, you want to rule out the stress. Okay, then you will verbalize the examination. Well, Eliza, after I have done speaking to you about this matter, I would also, after I have addressed your concern, I would also like to assess your general health, because just I would like to examine you just to know you're otherwise well for you to conceive a baby. Okay, so you have given a reason for examination, and then you will say, I will be checking your observations, which is your blood pressure, temperature, and heart rate. Also, I will be checking you, or not checking you. I'll be examining you from head to toe. Is that okay? Yes, that's fine. Okay, thank you so much, Eliza, for bearing with me or coping or putting up with me. I know this has been a long consultation, but we are almost done. Okay. All right, and then talking about Eliza, yes, you have told me your brother has got cystic fibrosis. May I know how much you know about cystic fibrosis? Well, doctor, I know this. Yes, you're right. And may I know, do you know how does it run in the family? Okay, or in which fashion does it run in the family? Doctor, I don't know. Then okay, no problem. I will tell you. Okay, or I'll go through it quickly. Well, Eliza, what is a cystic fibrosis? It's a problem in the gene. Now, genes are templates that have information about human body. Okay. Now there are thousands and millions of those. However, there's one faulty gene that can cause cystic fibrosis. Okay. Now this condition runs in the family as a autosomal recessive. Okay, which means if at all you have, in your case, you want to know the risk for your baby. You don't have the condition, which is a very good news. Okay. However, you could be a carrier. Okay. Now, if at all we find out that you are a carrier or your husband is a carrier as well, I will explain to you what are the risks or what is the risk in your baby. There's a 50% chance that your baby can be a carrier. There is a 25% risk that your baby can have this condition, and there is a 25% risk that your baby can be unaffected. Okay, or you can even draw this diagram and show her. Okay, if you want 12 out of 12. All right, doctors. So however, Eliza, at this point, we don't know about you and your partner being a carrier. So for that, we have to do a blood test. And for that, I would like to refer you to the genetic. Okay, so I would like to refer you to the local genetic center. Okay, doctor, now she will, after that, she can ask you a few questions. All right. All right, doctors. So I have gone through the session, I think more or less. If at all you have any questions about the session or about the course, you can ask me. All right, doctors. She can have some concerns. Doctor, what is the cost? It will be free of cost because you have a family history. People who do not have family history of cystic fibrosis and they want to go for this test, be paid. Okay. However, if any family history is positive of cystic fibrosis, then it is under NHS. Okay. It is funded by NHS. All right, doctors. All right. You are very welcome, doctors. And just a little bit about the course. The course is starting from 8th of September. It's a 2-week course. Okay. And if you want any further details about the course, I can let you know. You're very welcome, doctors, and I hope it helped you all. Okay. Doctors, it's pre-implantation genetic diagnosis. Okay. Pre-implantation genetic diagnosis where if at all there are any inherited conditions, okay, and there is a stronger risk, for example, if they find out that both the parents are carriers, okay, in that case, what they can do, they can conceive by, or they can do the test tube babies, okay, and in the laboratory, they can find out if at all the baby does not have the cystic fibrosis, then they can decide to implant that baby in the womb, okay. You're welcome, doctors, okay. So yeah. Anyone wants, you're welcome, doctors, you're very welcome. Anyone wants any information about the course? Course is starting from 8th of September. The session will be from 4 to 8. If at all you miss any session, you get the recording, okay? You'll get the recording of the session. All right, doctors. Okay, anyone has any questions? I'll unmute all. Okay, now you can ask me the questions. It's regarding Plab 2 stations, this station, or it's about the course. If you want to inquire, you can ask. Okay, I have unmuted you all.
Dr. Asia,
Yes, doctor.
I have one question. Like you said that, you know, in this particular patient, it's not very important to discuss about smoking. But what if such kind of patient, you know, in the end, once we are finishing our, you know, complete session, and in the end, if she tells you, you know, the doctor... Did
I say it's not very important?
No, I'm just thinking like if we don't take the smoking history in this particular patient because I
did not say, doctor, sorry, I'm interrupting you, but I did not say it's not important because I was overwhelmed when I was making these notes. I was overwhelmed by too many things that I missed Dessa today.
Yeah, I realized
while making notes. But no, any lady going to be pregnant, I think I have repeated enough times, any lady going to be pregnant, we have to make sure of her general health.
Right.
Okay, it's all right. So smoking is there, you know, it's very important. I did not say it's not important.
Yeah, that's it.
Right?
Yeah. Thank you.
You're very welcome, doctor. Okay, doctors, any other questions at all? Everybody's happy?
Doing this course in this month, following month, and every month.
Doctor, actually, I do locum jobs in between, so I cannot be certain that, you know, a locum jobs just can come all of, you know, sudden. So I have to decide according to that.
Yeah, we haven't booked our test yet. That's why we don't know when we will take our exam. That's why we're asking.
Yeah, but don't worry. If you're in the group, I'll keep updating you. Whenever I'm conducting a course near to that date, I will keep updating you, doctors.
I feel like if I take your course, that I may forget. If it is near to my exam, I can retain more. That's why I'm asking.
Yeah, definitely. That can be the case, actually. Yeah. All right, doctors. Okay. Anyone else has any questions, doctors, or can I leave now?
Thank you very much. Please, I wanted to ask you, how do we get into the group to stay informed? Some of us don't have a date for exam.
I tried to join, yes, but I couldn't.
Oh, okay. The group. Okay, doctors, let me post the link here again of the group.
Yes.
Okay. All right. Please don't leave yet. Okay, everyone. Okay. So, doctors, I will also post my number here. If at all you want to know about the course or you are not able to get into the group, I can help you. All right, doctors. Dr. PL has said, yes, you're welcome, doctors. You're very welcome. Dr. Denise want to know how the payment is made. Doctor, there are different ways I can allow you to make the payment. You can pay by PayPal. You can pay through bank transfer, Western Union, MoneyGram. Okay. So different methods of payment I take. All right. Any other questions, doctors? I'll look at the chat. Okay. I hope you're able to join now, doctors, to the group.
Thank you. Thank you.
Hello, Dr. Asya. Can you hear me? Will you post these slides on the WhatsApp group?
Yes, doctor, I will do.
Okay, thank you very much. Thank you.
Yeah, you're welcome, Sada. All right. Okay, doctors. Any other questions and queries at all? You are very welcome, Dr. Taslima. So, doctors, I'm here another next 5 minutes. If you have any questions, you can ask me any station, regarding any station or Plab exam or course. Okay. You're welcome, doctor. Okay, seems like everyone is happy and there are no more queries or questions. So we can.
I have a question, not regarding this station. If a lady is coming for counseling purpose for the contraception, so we have to give all the options, we have to go which are suitable according to her history.
Well, doctor, this is a very difficult station, and I usually don't promise. It is actually not in the layout of my course, but I still usually like to cover it because I know how challenging this station can be. Doctors, you have to go according, if I put it in short, you have to go it according to the history of the patient. Okay, but I have a very good layout for this station. Maybe, you know, in the future I can try to do a free session on that as well, because once upon a time, yes, Dr. Batra, yes, definitely. because once upon a time this used to come very often, okay, this station. If you have to talk about absolutely every option, then you will never finish. And there is a way how to go about it. It is very tricky, but I know the trick. Okay, so maybe in one of the free sessions, inshallah.
Yeah, because we have to be honest. We have to give, discuss all the options which are available. But then, if we are thinking about the time, we can't cover all the options.
We can't, definitely not. Okay, so ask, history will matter, because what contraception has she taken in the past? Are there any contraindication for OCPs? Are there any contraindications? For example, if she had any procedures in the past on her womb, or for example, if she is too young, then it's contraindicated that she can't have IUCD or even Mirena. If at all she cannot remember, then can she take pills? No, she cannot take pills if she cannot remember. If at all she has got depression, she has got risk factor of DVT, she has got high blood pressure, she has got family history of high blood pressure or diabetes, again, she cannot be offered OCPs. So you have to tell her according to her history that for you, this is the most suitable option. What would you like to hear first? Okay, you can give her 1, 2, 3. What would you like to hear about first? And let her choose, okay, what she wants to hear about first. I have given you a summary of that station, but again, it's a bit tricky. All right, doctors, any other questions? All right. Okay, doctors, seems like everyone is happy, so I'm gonna leave now. However, you can contact me on my WhatsApp number or through the group if at all you have any other queries about stations or about the course. Okay, before the course starts on Tuesday. Yes, doctor? Anyone had a question? Okay. So doctors, before the course starts on Tuesday, the 8th of September, I will try to do one more free session at least. I am very, very busy, but I will try my best, okay? Because I want you to all, be helped. So I'll try my best. However, I can only try. Okay, doctors, take care. Thank you so much for your time. And yeah, take care of yourself, and I'll see you soon. All right, doctors, take care. Bye.
It's finished now. It's finished. What's the relationship with Jennifer? Can you contact her age for me, please? I'm here to talk to you about your concern.
Okay.
Yeah. So how can we help you? Jennifer.
The daughter I went out to also started working just for 2 months. I'm worried. Every other child started working. Some people started working at 9 months. I'm just concerned.
That's a very concern. And it shows that